Hi everyone, I'm Nomad Nurse Z. I'm the remote nurse coach, and I help nurses find remote nursing jobs that don't require previous remote experience. In today's video, I'll be talking about what a remote nurse is and how you can get started. If you stay to the end, I will tell you about how we can talk one-on-one if you're really wanting some help in this whole job search progress. So to begin, what is a remote nurse? Well, it's still a nurse. And what they do is they either review, coordinate, manage, or reimburse patient care. Oftentimes that will be through phone or internet. It's often going to not include the traditional face-to-face interaction that you have with patients. However, there are still jobs where you will have that patient interaction. So don't worry if you want patient interaction still, if that's something that makes you nervous to give up. There are still roles where you can do that. And you know, a lot of people ask me, okay, well, what type of role should I be looking for? And that's really hard for me to tell you without knowing a lot more about you. And here's the reason why. The reason why that's kind of a loaded question is the same way it's kind of a loaded question when a nurse comes out of nursing school and they say, okay, what type of nurse should I be applying for? Like what type of job in the hospital? And it's kind of like, well, what do you like? You know what I mean? There are just so many different specialties working in the hospital: ortho, EMT, med surg, tele, ICU. You know, but then also within those specialties, you know, they're going to have multiple units. So like 4 West is going to be different than 4 Main, you know, even though they might do the same thing, like they have a whole like different way of doing it sometimes, you know, like within tele, there's hard tele, there's soft tele. So that's kind of the same way when people ask me, you know, well, what type of role should I be applying for? And that's really something that there's just so many different opportunities. It really just depends on what you're looking for. So that's really what leads me to my next segment of this video. The first part being, what is a remote nurse? The second part is, where do I get started? And as simple as this sounds, you need to get started by looking within yourself. And I think that's also what you might tell the new grad nurse, you know, just maybe in a different way. You might say, okay, well, what do you like? So if you don't like the look within question, ask yourself, what do you like? You know, do you like working with patients? Do you prefer working with data? If so, you should look at jobs, you know, suited for that. If you don't have any preference, then that's something to know as well. The other thing as well is, you know, are you going to want to be tied to a phone if you are seeking patient interaction? Some of the positions will require that you're on your phone the whole time. Some people really don't like that. And then the other thing that I kind of want to talk about after you've done the look within, you know, what do I like? Also, like, what makes your soul light up? You know, is it the patient education aspect of it? Is it actually seeing somebody go from, you know, a terrible condition to recovering? Is it that you really like helping people with their mental health crises, and you like being there for them in their darkest moments? I don't know that information, only you do. So my other question is, you know, what makes your soul light up? Like, what do you like about nursing? Only you know that. And my next question for you would kind of be regarding what makes you unique. Now, the thing I really like to ask everybody that maybe you're going to roll your eyes at, but I like to ask this because it brings to light maybe something you might not otherwise think of. And that question is, if you were in a lineup of 50 nurses and they asked you, what makes you unique as a nurse? What would you be able to say where only maybe a handful, like 5 or so nurses could also say? You don't have to be completely unique, where nobody else has the same thing, but only a handful of people could maybe say, that's something that makes you unique. And this is something that people don't really think about because it's not something like your brain kind of like naturally goes to. But to give you a real life experience, or application of this question is, if I were in that lineup, my thing that would make me unique would be a couple of things. Number one, that I'm bilingual. I try to be. And then the second thing is that I have bone marrow transplant experience. Those are 2 things that when I was applying for remote nursing jobs, I really tried to keep in mind that these were things that other people may not have, especially having both of them. There's going to probably be even less amount of people that have those things. So what makes you unique? And usually it's the first thing that comes to mind. It's usually not going to be something that you have to think about, for like 10 minutes. I want you to go with what comes to mind first. And it doesn't have to be something super like complicated, like even mine. Like mine had 2 things in it, but if you have 1, that's okay. I'll tell you about another experience. I was working with a nurse, and her answer when I asked her this question was military experience. And that is something that we really want to focus on, because not a lot of nurses are going to have that military experience. And it seems sometimes so simple when you're hearing other people and how they're answering it. But I'll tell you, it's going to be just as simple when you've said what your thing is. The important thing here is that you're honest, okay? None of this like, oh, well, I'm the best nurse there is on the unit. None of that. And it may be true, but that's really not going to help us here. I'm talking about skills. I'm talking about education. I'm talking about personal reasons why you went into nursing. I had another nurse that I worked with, and her thing was that she had to take care of her mom from a very young age, and that's what actually got her into nursing. And so working with her, my recommendation would be that she kind of focus on those type of roles where maybe she's helping families who are caretakers. Imagine her applying to a caretaker remote role, and during the interview, they're like, okay, tell us about yourself. And her answer was, well, I decided to get into nursing because from a young age, I had to take care of my mother. And now I want to make sure that it's even easier to take care of their family members than it was for me. Imagine the power to that kind of story. Now, I just said that. This is totally unscripted here, but imagining like having that even more polished, having an even like better emotional connection with, the phrases that she used, or maybe a real life story of how that came to be one day. Those are the things that make you unique, that matter in this whole remote job search. And again, the thing I want you to take home is that it's usually the first thing that comes to mind, and you have to be honest. If you do both of those things, you should have an answer to what makes you unique. If you don't, then, talk with me. I do offer one-on-one coaching. And this is something that I will help you kind of discover those things about you, because they're there. We just might have to uncover them or peel back some of the layers, and that's okay. And if you are interested in that, feel free to reach out to me at nomadnursez@gmail.com, or you can go over to my Instagram, which is also nomadnursez, and you can send me a DM if you would like to be involved with that coaching. Just let me know that's what you're interested in. And if you do want to sign up for coaching, I'll tell you more about the package and everything once we're on a call. But I will give 20% off for all of my YouTube followers on here. And you can just let me know that you found me through YouTube. I'll give you 20% off. So Nomad Nursey, and bye for now.